Welcome to this ASN Kidney 360 podcast. I'm Nicole Wyatt, a second-year clinical fellow at Vanderbilt University Medical Center. Today, I am joined by my colleague, Dr. Osama Al-Shami. We'll be discussing our study entitled Survey of Peritoneal Dialysis Patients' Experiences During the COVID-19 Pandemic, a multi-center study, published in Kidney 360. First things first. Why did you decide to study peritoneal dialysis patients' experiences during the COVID-19 pandemic?
Great question. Really, during the pandemic, many changes were made to the workflow of outpatient home dialysis clinics. However, understanding how these changes affected the patient experiences and the overall impact that the pandemic had on their mental health and well-being are things that hadn't been studied. And learning from our experiences as providers and the patient's experiences is important in the event that we do encounter a similar pandemic in the future. So I thought it was worthwhile to organize this group of centers across the country where we tally together what our patients went through during that time and learn from it in order to be better prepared for future instances where we have to adjust and make similar changes.
And what were the main adjustments made by institutions regarding peritoneal dialysis patients during that period?
Well, the changes varied based on each individual institution. In some cases, it started before patients left their own homes, with nurses calling the patients and asking them about COVID-19 symptoms and exposure screening questions. Once they got to the waiting room, all the institutions in our study did not allow family members in the waiting room. Now, in some units, seats were also blocked in the waiting room to make sure that social distancing was maintained there. And family members, in some cases, were not even allowed to come to the clinic rooms with the patients, even though they may have come with them to the clinic. Patients were all required to wear personal protective equipment, or PPE, and the same was required, of course, by the dialysis staff. Some units then also increased the use of telehealth during that time period, especially to conduct their monthly visits. And that, I think, increased exponentially really across the United States, and not just in nephrology, but in other specialties as well. And this necessitated that patients adjust and learn how to use these various communication platforms. And in some instances, there were changes to how patients received their dialysis bundle medications. In some units, the patients used to just pick them up when they came to their clinic visits before the pandemic. But in others, then during the pandemic, they were either delivered to their home or they were left in packages. And the same can be said about the lab draws. Some patients still came to the unit for their lab draws, and other centers actually contracted with courier services where there were phlebotomists that would come to the patient's home to draw the blood work. These are all changes that I think are important to note and for us all to learn from together, and then be able to understand how and if that impacted the patient's experience during that time.
Absolutely. That all sounds amazing. In regards to how it impacted patients, what were the main patient experiences and perceptions of challenges that were mentioned by patients that you noticed?
Now, luckily, our study found that overall patient experiences and perceptions were pretty positive. The vast majority of patients didn't need new accommodations to do their treatments at home or have issues getting their dialysis supplies and medications delivered to them. We also asked patients if they considered switching modalities during that time period, and very, very few patients considered switching modalities, which was very reassuring. Most patients didn't really fear coming to the dialysis unit because of the pandemic, and they reported feeling supported by the dialysis staff. Some of the questions of the survey that we had were to assess patients' anxiety and depression scores, and they had overall very low anxiety and depression scores, which I thought was great for their well-being. And granted, this was a retrospective survey study, so we surveyed those patients after the fact. But patients' lasting perception of that period appears to be relatively positive overall in terms of their dialysis experience and their experiences with the dialysis nursing and staffing support during that time.
So given all these things, what do you think the potential implications of your findings will be for possible future pandemics?
Well, these findings show us that the adjustments that we made were overall very successful. If another pandemic were to happen tomorrow, for example, we would recommend a pre-screening policy for patients, not allowing family members in the waiting room, not allowing family members in patient clinic rooms, although we can always communicate with family members over the phone or using other methods of communication at the time. That way they still feel involved, especially if they're care partners for patients. And oftentimes if they're care partners, they're an important role for important history and details that patients may forget about. We would, of course, require personal protective equipment for both patients and providers, and continue the expansion and use of telehealth capabilities in such an event, as well as delivering the patient's bundle medications directly to their homes rather than having them come to the unit to pick them up. There can, of course, be other adjustments or variations based on individual patient needs and dialysis unit circumstances, because we have to understand that not every unit is able to accommodate patients and make adjustments the same way, and not every patient is amenable to those same adjustments. But overall, as an overarching theme, these are some of the things that I think are the main takeaways from this study.
Finally, what do you think the gap in knowledge is, and what might be the future direction of research?
I think, to be honest with you, currently there are no glaring gaps. A lot of the decisions that were made by the providers at the time, but there's also some input from patient groups such as the AAKP that weighed in into some of the interventions that were made and recommended by societies. What we would like to do differently next time, perhaps, is to perform these surveys during the pandemic or the medical emergency that's taking place, because this would allow for less recall bias, as well as the collection of objective data that would provide more substantive insight into patient treatment compliance, for example, and issues that they face during those trying times. A lot of these relied on patients' recall in terms of, did you miss any treatments or did you have any problems? But if we were reporting it real time, I think that would have provided us with true insight into what they're going through at the time, and a true reflection too of perhaps anxiety or depressive scores during that period rather than just looking back on it.
Awesome. Thank you so much for your responses and your insight into this very valuable information. And thank you, listeners, for joining us for this Kidney 360 podcast.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.